It is indeed my pleasure to be here among you this afternoon on the grounds of this new facility to engage in such an exciting and significant activity. The commissioning and renaming of this brand new primary health care facility. Indeed, this is a time for much celebration. For today, our Team Unity administration is delivering on yet another strategic promise outlined in the National Strategic Plan for Health 2017-2021, as it embraces the United Nations Sustainable Development Goal number 3, family health, good health, and well-being. This commissioning is notable because primary health care is an individual's first point of contact with health services and provides point of entry for the entire health system. And I think at this time, I recall my meeting that I would have had with the coordinator for community nursing services and her deputy, Nurse Irish and Nurse Robinson. And in that meeting, Nurse Irish would have started the meeting by saying, Minister, community health is the most important aspect of healthcare in St. Kitts and Nevis. By the end of that meeting, I had to agree with her that community health is the most important aspect. Yes, CMO, and yes, Medical Chief of Staff, and yes, Matron. Community health is the most important. Right, Nurse Irish? There is evidence that access to primary health services is linked to a better health outcome, including improvements in self-rated health and a reduction in all cause of mortality. Why I say it's the most important. And Nurse Irish would remember that I committed to ensure that our primary health services are recognized and utilized so that we can achieve the desired results of improved health and reduction of all causes of mortality, and more specifically NCDs. So look out for a more in your face, I'll put it that way, a more in your face campaign as we try to get everyone in St. Kitts and Nevis paying more attention to their primary health. And so you will be hearing a lot more from Nurse Irish and her deputy, as well as the community health services, which is led by our director, Nurse Liddy. So I guarantee, and again, Nurse Irish, I commit that we will put the efforts behind ensuring that community health service gets the recognition that it deserves. Because primary health care places a strong emphasis on preventative interventions, it has been found that countries with a higher ratio of primary care facilities per population correlates with reduced rates of disease, morbidity, and mortality. This principle is therefore significant as the Federation of St. Kitts and Nevis faces increased menace of non-communicable chronic diseases such as hypertension, diabetes, cancer, and kidney diseases, which consequentially possess a serious threat to our country's health and wealth. We have heard our immediate past Minister of Health, the Honorable Wendy Phipps, speak to the statistics. And today I wish to remind us all that the Federation's statistics are startling, with a remarkable 83% of deaths being caused from complications of non-communicable diseases and deaths that can be avoided. This is disconcerting, and because the Ministry of Health is cognizant that the greatest burden of diseases is usually on the disadvantaged and socially marginalized, the ministry reaffirms its commitment to providing health care for all. Healthcare for all the people of St. Kitts and Nevis. This will be done in a holistic manner, thereby reducing our perception of inequalities. One of the World Health Organization global strategy for the prevention and control of non-communicable diseases is a new approach which includes managing the prevention and control of other diseases such as cardiovascular and oral diseases. I also had a meeting this week with the dental surgeon who reminded me that dental health is also important. And so I just want to implore everyone. The facilities are there. Newtown, Mary Charles, and Keon. Access that dental care if we are to ensure the health of our nation. And Sandy Point, sorry. With the increasing evidence of the health-promoting influence of primary care, which reveals that primary care helps prevent illness and death, regardless of whether the care is characterized by a large cadre of primary care physicians. We are fortunate in the Federation of St. Kitts and Nevis that our expansive primary care package, which extends across the life continuum, is comprehensive and free of charge. Comprehensive and free of charge. I'm not sure how many persons understand what we have here in St. Kitts with our primary health care. Comprehensive and free of charge, and you will hear me speak to that more. This fact, I strongly believe, requires publicity and a campaign that we will develop with the community-based health services team to ensure that the general population is aware of the services offered or primary care, at our primary care and facilities, and how they can access those services. This campaign must also reach the most vulnerable groups among us so that they are able to access care that they require and which is available to them. It is important to note that the Ministry of Health has engaged purposeful renovative upgrades, as the health planner would have indicated, in all of its health centers in St. Kitts over the period 2019 to 2020. Yes, that's worth a clap, because I'm sure many of you would remember where our health facilities came from. In fact, it is noteworthy that we are in the rendering stage of the brand new health center in St. Peter's to commence soon, and the design phase of the new Bastyr Health Center. We intend by these renovations to guarantee that no one gets left behind. And this is why a full campaign to promote our primary health service will be pursued. Our reason for being here is therefore highly momentous, as we will now have the new primary healthcare facility in Tabernacle. I like that name. Instead of saying health center, it sounds a lot more upscale and luxurious, just like community health. Primary healthcare facility. And this facility will bring equitable, high quality primary healthcare to the citizens of this district. The services would include, but are not limited to, and pay attention because all of these services are provided at all of our health centers. And so I want everyone to pay close attention. Child health and immunization. That's the one we hear about a lot. And I know many of us use that service, but there's also antenatal and postnatal services. Family planning, yes, family planning is still available. Chronic diseases such as diabetes and hypertension management and district medical officer consultations. School health, HIV/AIDS prevention and treatment, home care for shut-ins. That's just a few of the programs and services that are available. But in addition, we intend to expand the programs and services at this new facility, as well as the others, to promote new initiatives such as multidisciplinary chronic disease management, with expanded nutritional counseling and physical activities, particularly among our young people, to prevent overweight. Improving diabetic foot care through the development of a foot clinic. Diabetic foot disease, foot ulcers, and amputations reduces the quality of life for so many of us. A foot clinic has the potential to lengthen lives and to reduce our reliance on NHS and the cost to NHS. Seasonal case management for clients with diabetes, hypertension, and renal diseases, spending quality time with the clients to ensure self-management skills. Our nurses are very versed and they can teach you and help you to manage your symptoms. And so you must visit your primary health care center in order to receive those services. Occupational therapy for individuals, groups, or communities. Too often, persons with chronic diseases unfortunately lose meaningful occupation because of their ailments. With the expert use of assessment and interventions available at this new facility, persons with chronic diseases can recover well and attain maximal function to engage in meaningful activities for economic sustenance. Hearing screen clinics to continue to facilitate the activities formerly conducted under the Staki Hearing Health Care Services and conduct hearing health clinics. So please, even if you think that maybe I can hear a little, because I know some of us we tend to say, well, just talk a little bit louder. Take the opportunity, visit the hearing clinic and get that assistance that you need. This facility will also have a new and modern conference room and teaching facilities. The intention is to be able to conduct physical and virtual continuing medical education sessions for community health practitioners, being cognizant that continued learning and education is crucial to the professional development of our healthcare providers. We want them to always be at the cutting edge of health so that you get the care that you need as well. This facility will also offer a contemporary isolation room. With such a room here, it is definitive potential to contain the threat of certain communicable diseases. And so, ladies and gentlemen, the commissioning of this new facility this afternoon is timely, and I'm sure you would all agree. I am pleased that we have present a wide variety of current, potential clients, including the students of the Edgar T. Morris Primary School, who we trust will aggressively access the services of this new facility and speak to their parents and encourage them as well to access the services here at this new facility. Certainly, this is an attestation of an improving healthcare system with a critical primary care component. Undoubtedly, such a system will increase efficiency and improve outputs to foster positive health outcomes of our people. And that is what we are aiming for, positive outcomes. No more death by NCDs when we can prevent it. This, my friends, is a pellucid indication that at the constituency and ministry level, we do recognize the need to build out facilities and services and understand the fundamental importance of preventative actions to mitigate health risks, decrease prevalence of diseases, particularly NCDs, among our vulnerable population, and ensuring a stronger and safer health system. We are here this afternoon to demonstrate that we have kept our promise and to espouse the ministry's motto, people first, quality always. And if you visit our health centers, you would understand that. It's always people first and quality always. We are making major strides in the development of quality healthcare delivery at the community and institutional level, and we will persist to do so during our tenure. We intend to continue to advance our priority for disease prevention and reduce modifiable risk factors and evaluate our processes accordingly. I promise we will stay on top of this agenda. In conclusion, let me take this opportunity to commend the government, the benefactors, developers, and outfitters of this new facility. To the Taiwanese, thank you so much for your contribution, and for your significant contribution, that is. The actions of these men and women have defined the very space in which we are now gathered. Our community and health sector is proud, vibrant, and will continue to prosper. And I assure you that the Ministry of Health will continue to do all that it can to ensure that the health of our nation is of top priority. And looking forward to seeing many of you at our different campaigns and rallies. And when I visit the community centers, I'm hoping to see the doors filled with so many people trying to access the cares at our different facilities. And so remember, your health, it is up to you as well to ensure that you do what you can to secure the health, not only of your individual health, the health of your family, the health of your neighbors. Because at Ministry of Health, we understand it's not just about the ministry, it's all of us. And the way in which we choose to look at our health and care for ourselves. And so I am imploring everyone, please use the services provided by our community, our health centers, and be sure to take care of your own personal and individual health as well. And with those few words, I just want to say thank you for listening, and I'm hoping to see all of you at a community health center in the near future.